Hello, Dr. Berk. We've diagnosed varicocele. It was also clearly understood that we absolutely need to have surgery. How does the surgery go? What do we do in the surgery? I'll briefly explain this. Now, I've received some criticisms. Someone says, Professor, you never include your own surgeries while explaining the surgery. I generally don't like to include real images. Everything is very clear and understandable in the animation. We're actually working in a very small area. It's quite difficult for you to understand this as well. That's why I want to explain the animation. First, let's take a closer look at our skeleton and enlarge it. Look, I've divided the testis in half. This is the testicular vein that appears in blue. The artery of the testis that appears in red. We have nothing to do with the artery. Our job is with the vein. I mentioned it in the previous video. This vein comes up from here and goes all the way up to the kidney, connecting to the kidney's vein as I mentioned. Now, we usually don't perform the surgery from this lower area. We perform the surgery right from above the groin. Let me explain this like this. Let's add fat layer, then let's add the skin layer. Let's enlarge it like this. Our surgery site is right above the groin. So let me draw this with a pen. We're making an incision 2 to 3 centimeters, open it up like this. We make an incision of about 2-3 centimeters like this. We open it up like this. When we open this up, when we lift the tissues here, it takes us directly to the testicular vein. Let's look. Yes, look, the testicular vein passes through here. Look, our line is here. We can extend it a bit more. The place where our testicular vein is located is where this blue line passes. We reach this area and safely tie off and cut the vein here. Now, of course, performing the surgery with the naked eye is quite different from doing it under a microscope. I specifically made this image this way. Look, there are a lot of them here. There are a lot of tiny structures like lymph tissue, nerves, and arteries. Most of these are not visible to the naked eye. When you do it under a microscope, it's much easier to just find the vein, tie it off, and cut it carefully and precisely. And at the same time, we don't damage the surrounding structures either. For example, what could it be? If it's not done with a microscope. This is an example right here. These are the green lymphatic vessels. If this is accidentally tied off, or if it gets damaged instead of being tied, then fluid can accumulate around our testicle after a while. This is called a hydrocele. If it's done with the naked eye, it can be visible up to 30% after the surgery. But if it's done under a microscope, it can drop to as low as 3%. That's why it's especially important for the surgery to be done under a microscope, which we call microscopic varicocelectomy. Here. I hope I was able to explain what I wanted to. Thank you.